Hi guys, this is Karthik from CAAPID Simplified, and this short video is to help you with UCSF Supplemental answers. I've put a presentation over here so that you can pause and watch the YouTube video to get an idea of the format or template. There are 6 questions in the UCSF Supplemental answers. Each question has about 1500 characters as a character limit. If you were to divide these 1500 characters into 4 sections, it will make your writing very efficient. The way I divide it is in having an introduction and build-up, giving 2 paragraphs that provide context, and a final paragraph that ties the entire thing up. Question 1. How have you prepared yourself for learning and practicing in the US? It's key to remember that learning and practicing can be both in the school while you're doing your DDS and after school while you're practicing as a dentist. The 4 sections I would divide this into are introduction and build-up, evidence generation, another aspect of preparing and learning, and finally closing and tie-up. Of course, you're okay to pause now and read through the context so that you can use this as a template to answer your question. But I'll give you one example of how I would answer this. I believe UCSF is a very credible school and takes students who are able to cope up with great academic pressure and bring a research-oriented perspective to clinical dentistry. In the past, I have worked in an organization that does research with Americans all across on a specific problem. This problem that I faced was during MPH, and I worked on patients who were having public issues in getting dental insurance. During this entire program, I learned great research skills like how to do an analysis, a meta-analysis, how to collect data and interpret and process that. From there, I believe I have developed the right qualities to apply a research-oriented mindset to clinical dentistry as expected in the candidates in UCSF. I wish to bring this research orientation and educate my fellow classmates in also looking at clinical dentistry in a different light and applying the basics of evidence-based dentistry that can make a difference for our entire community. I hope that example helped. If you want ideas for more examples, feel free to call us and we can always brainstorm. Second question, a time you made a mistake while practicing dentistry. Very difficult question, I understand. What was your situational role and why did you learn? The way I would divide this is in the same 4-point format. Beginning with introduction, talking about your mistake, talking about how you overcame that mistake, and finally tying the story up. An example that walks through the entire question is this. While I was working as a dental assistant in Virginia under a great family dental practice, I faced a unique situation. I had very less experience and I was speaking to a very competent and a very diverse team of family dentists. During the situation, I accidentally brought up a misunderstanding when communicating to one of the dentists who was from the Asian American community. This is because I came from a nation that has its own biases towards people from Asia, and I misinterpreted a certain person's culture. I made a comment that all Asians are good at math, and therefore my fellow dental assistant who was from an Asian American community can become a good orthodontist. This brushed us off really bad and it ruined our relationship. I eventually overcame this problem by speaking to people of different communities and understanding what was sensitive to them and what wasn't. I went back and resolved the situation by confronting my colleague on this very problem and letting him know that it was a genuine innocent mistake because of the preconceived notions I had had and apologized. In the future, when I come to UCSF, which is known for its amazing diversity of fellow colleagues, I believe I will always take a pause, understand what's sensitive to a certain culture before expressing my thoughts freely. This way, I hope I can nurture the community's interaction level and stand as an example or beacon for my fellow classmates to interact with one another. I hope that example kind of covered all the points here. You can always pause this video and read through this template as you prepare your answer. Question number 3. Outside of dentistry, share something unique that would benefit IDP 24. So your fellow classmates, how have you helped them? The way I would break this answer down is in 3 simple parts. First is an introduction or build-up. So you should say, for IDP 24 students, what are expectations? Next is tell them what is the unique aspect that you provide to benefit this group or cohort of people. Finally, connect the story by saying, I will make this real by working with the society. Now let me give you an example. Clinicians at international dentists at UCSF will need to work with a new set of patients. While most of them might have experience working with adult or geriatric patients, the exposure to periodontic or pediatric patients might have been very less or less prevalent because of the lower number of clinics dedicated to this population. My own experiences working with children of special needs during my volunteering with so-and-so community has given me the sense of respect and empathy a child or a millennial in the US deserves. They have different problems, for example, abundant misinformation and low attention deficit spans that actually distract them from preventive dentistry and listening to their parents. I will use my experience working with such a patient population and inculcating good habits in them by teaching that to my fellow classmates and helping them relate and connect with children visiting UCSF's clinical rotations. Eventually, I wish to work with the Pediatric Society of UCSF and make these ideas of how to deal with children and an institutionalized concept, a curriculum maybe, and share that with fellow classmates, which is easy to access and easy to engage. In this way, I hope to enrich the understanding of dealing with pediatric patients and make a difference to my fellow IDP classmates. I hope that example was clear, and I hope this entire video was super useful with the templates. Feel free to use this. We will make another video with questions 4, 5, and 6. Thank you for watching. If you had watched this, please refresh this video and watch the advertisement at the very beginning once more. That is the only way you can contribute to our efforts without having to pay any money. Thank you so much.